Sunny.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 470. Thank you so much for joining me. I really appreciate it. Today's show is going to be about nail biting. Is nail biting really bad for your teeth? We're going to delve into the world of onychophagia. It's an interesting name, and when I first started researching this topic, I thought, oh, brother, somebody had to give it a fancy name just to make it sound like dry. But anyway, hopefully it won't be dry, and we're going to find out, because it's funny, because I've been doing 469 shows so far. This is 470, and I've never covered this topic. So I was a little surprised myself. By the way, my mom was a nail biter, and I remember growing up watching her kind of gnaw at her fingers, and, you know, one of the nail biters that went all the way down into the skin almost. It's very gross looking, and I just couldn't figure out why she couldn't stop. It was, embarrassing as a kid, and I kind of felt sorry for her as an adult. And so, you know, I'm not a nail biter, but I know a lot of people are, and guess what? Nails are very hard, and so you are just, when you bite your nails, you're biting down on something that's very hard, and that's putting a lot of pressure on the teeth. Before we get into that in more detail, let me just remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you would follow me on Facebook and like us, that would be awesome. It's Dr. Kvitko and Associates. And all past episodes, complete with video, are available at thereasonswesmile.com. Okay, so let's just see. So yeah, like I said, it was onychophagia. And the definition of onychophagia, or nail biting, is an anxious behavior in which the free edges of the nails are chewed down as a means of expressing or relieving stress. That's just one of the definitions that I found. There are several, and I think we all kind of understand what that is. Hard to put into words. There's a gentleman in North Carolina, Dr. Wells. He wrote on his website, which I don't have right now, but hopefully that's enough props for him, some of the things that affect the teeth. Okay, so when you bite your nails, what does it do to your teeth? And by the way, if you're watching the video, right now I have Prince William and his wife Kate, and she bites her nails. There's a picture over there, right there. Okay, so one of the physical issues is cut or damaged gums, which are injured by sharp, jagged nails. They create wounds and sores on the gums, which can easily become infected from bacteria that exist in the mouth. All right, another one is it can lead to malocclusion, or simply improperly aligned or misaligned teeth. Nail biting causes patients to align their teeth incorrectly in order to properly bite the nail, which then leads to jaw growing into permanent misalignment, and malocclusion can be a cosmetic and health problem. All right? The most common and unfortunately the most severe dental consequence of nail biting is the development of bruxism. Now, bruxism is the unintentional grinding or clenching of teeth that may cause dental injury or facial pain. Many nail biters report the same symptoms of facial pain that are commonly associated with bruxism. Others go on to develop extremely painful symptoms such as tension headaches, muscle tension in the face, jaw pain, and sensitive teeth. Nail biting can also cause another symptom of bruxism, which is the erosion of teeth and tooth enamel. And as a patient grinds their teeth into the nail of the finger, the tooth becomes more susceptible to chipping and can easily wear down. In some cases, nail biting or bruxism can result in receding gums. And even when nail biting does not present the same dangers as bruxism, nail biting can lead to the development of bruxism. And patients who are nail biters report that after biting their nails for many years and never having any issue with jaw clenching, they suddenly notice themselves clenching and grinding their teeth at night. Often nail biting can cause patients who are nail biters to develop this bruxism situation, which is grinding your teeth. We call it bruxism, and I can make people a bruxism appliance, but they're about $400 or $500, so if you can avoid that, that would be awesome. Because bruxism causes serious, irreparable damage to your teeth and jaw. So remember that for all of you nail biters. Now, on my way here, or when I was getting up this morning, getting dressed, I was tying my tie, and I noticed that my one finger is sore right by the nail. And I remembered that just yesterday I had one of those little, like, extra pieces of a nail on the side, you know? It's not attached to the big one, and it looks like something you should bite, and I don't do that. But what I did was I grabbed some clippers, and I pulled it out. Now it's all puffy and sore. So, there you go. Perfect timing for this show. Okay, now, there was a woman, let's see, let me just get the, yeah. Okay, so somebody, and I don't remember who wrote this, but somebody put on there, 22 problems only people who bite their nails won't understand. All right? So 1, the answer to how long have you been biting your nails is forever. The thing is, you don't even know you're doing it. While it might look disgusting to others, you can't help it, right? It feels almost euphoric to you, and it's deeply satisfying, almost incredibly so. You know the sight and taste of those little pieces of bitten nails all too well. It goes from tasting to disgusting to actually becoming tolerable, because you're still doing it, right? When you have a hangnail or a jagged edge, you have to bite it off. You just have to, right? Am I talking to you? Just like I was talking about that nail on my finger? Yes, everyone knows it means you can get infections. We all know that. You know, you can get infected from doing this, but you still do it. And yes, sometimes they do bleed, but no, it doesn't really hurt that much. Or at least you get used to it, right? Nail biters know their fingers can look pretty horrid at times, and I have some pictures up on the video cast that you'll see of some pretty ugly pictures. Some were so ugly I almost didn't use, because it was like, oh, do I want people to see that or not? Nail biters, okay. You have no idea how people grow their nails long enough to do those fancy manicure jobs, right? You have to think of inventive ways to scratch yourself because, of course, you have no fingernails, so you wind up like rubbing your back up against or your side up against the corner of the wall, right? You can't physically open a pop or beer can without the help of some kind of a key or other device, right? You have to actively try hard not to do it during important business meetings so you don't look like a crazy person. You may not ever admit it, but you secretly leave tiny bits of nail everywhere you go. Oh, just give up. Well, it's not that easy. All the solutions just seem kind of pointless. And even if you do manage to stop, you're left with another problem. For example, got rid of your nail biting habit, but you can't seem to stop peeling the dry skin around the nail. And number 21, you could deal with it by getting hypnotized, but that sounds kind of weird. And what if it doesn't work? And also the thought of being hypnotized is making you want to bite your nails. At least it doesn't hurt anyone but yourself, right? So that's 22 things people who do bite their nails, I'm sure, can relate to. And by the way, if you're just joining us every week, we do a Dr. Kvitko question of the day. You're given a chance to call in and win free flowers from the Santis Florist, and that's going to be coming up soon, so you may want to have your phone handy. In fact, don't call now, but I'm going to go ahead and give you the number so you can have it pre-dialed into your phone. It's 614-459-9769, so kind of pre-dial that, 614-459-9769. And in a minute or two, we will do that. So if you're watching the video podcast, Britney Spears' picture is up there. She is a nail biter. All right, so I'm going to recap the things that can happen to your teeth if you bite your nails, and then we're going to do Dr. Kvitko's question of the day. Okay, so chewed on nails are not only unsightly, but they may cause big harm to your fingers. Nail biting wreaks havoc on nails and cuticles, but did you know, as we're talking about today, can actually damage teeth. Biting nails is a bad habit that often begins in childhood. Studies suggest that 60% of kids and 45% of teenagers bite their nails, and while it's less common after age 18, up to 30% of people continue to bite their nails. This is through adulthood. Most of the time, nail biting is a reaction to stress, but it can also be an unconscious nervous habit caused by boredom or frustration. And nail biting concentrates force in one spot and can result in a fracture of the tooth, chomping on your fingernails can also lead to chipped teeth or broken dental restorations. In extreme cases, the habit can even cause TMJ disease. And then that, of course, includes pain in the muscles and ligaments that we use to chew the joint. Used to chew with, and pain in the joint. Biting your nails places excess stress at that joint. Now, think about it. Something hard hitting something hard. And our teeth are very hard. We know that. Enamel is the strongest or hardest natural occurring substance, living substance, right? But if you take a pickaxe with a big, hard, sharp metal, shiny edge and hit it onto a piece of metal, it's going to get dull, maybe even get chips out of it over time, right? So, anyway, what else? Okay, so let me just recap. Things that can happen to your teeth are tooth fracture, you can chip your teeth, and it can cause you to brush your teeth. Those three are the important ones to remember, as well as broken restorations, TMJ, and malocclusion, and the things that go along with bruxism, which was one of them, which is facial pain, headaches, tooth sensitivity, recessed gums, tooth loss, and jaw pain. Okay, well, I think it's time to do Dr. Kvitko's question of the day. You're going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
Okay, obviously I jumped the gun and had you call in before you heard that little disclaimer, but the phones are going to stay open and you can still call in and win. I'll just restate the question, which is, nail biting, also known as onychophagia, can do what to your teeth? Can it do A, chip your teeth, B, fracture your teeth, C, cause you to brush your teeth, or D, all of the above? So, chip your teeth, fracture your teeth, cause you to brush your teeth, or D, all of the above. And let me just remind you, the number is 614-459-9769, 614-459-9769. So the lines are open. Feel free to call in, and while you're doing that, we'll listen to some commercials, I guess.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go! Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. All right, we're back. We're doing Dr. Kvitko's question of the day. We have 4 callers on the line. We have Denise, Barbara, Tim, and Jackie. And we rolled a dice during the break, and it came up Barbara. So, hey, Barbara, how are you?
I'm wonderful.
Thank you for listening. Thank you for calling in. And thank you for being wonderful, by the way. Because, you have to be positive, right? Sounds like you're a very positive person. And so what is the answer to the condition of nail biting known as onychophagia? What does it do to your teeth? Does it chip your teeth, fracture your teeth, cause you to brush your teeth, or D, all of the above?
D, all of the above.
That is correct. That's correct. Well, thank you so much. And stay on the line because my producer will get the information to where we can have DeSantis Florist send you those flowers, okay?
Thank you so much.
You're very welcome. Take care now. All right, so while he's gathering her information, let me just move on. And so, this nail biting thing, like I said, it does a lot of damage. And I tried to grab as many pictures as I could for the video cast, but had a little trouble with getting them all to download, and so what I'm getting at is there's some mixing ones. Some ones I had a lot of what kind of damage it does to teeth, and they didn't all make it into the video cast. But if you are interested in the topic and you want to know what kind of damage, you can type in, do a search of tooth damage from nail biting, and they'll come up. Okay, now let me just talk a little bit more about bruxism, which again is the unintentional grinding or clenching that can cause facial pain, headaches, tooth sensitivity, recessed gums, and tooth loss. The signs of bruxism include flat-looking tips of the teeth, tooth enamel that is worn off, causing extreme sensitivity, popping or clicking of the jaw, and indentations of the tongue. Other dental health risks for nail biters can include sore, torn, or damaged gum tissue caused by jagged, sharp fingernail edges and the spread of bacteria from other body parts to the mouth, and from the mouth to the nail beds or bloodstream. Patients might find that wearing a mouthguard can deter nail biting and help prevent further damage to teeth. Some dentists can also help patients use therapy techniques like learning how to rest your tongue upward with teeth apart and lips shut to avoid tooth damage. Now, when I do have somebody that's bruxing, this is a good point, but what I also do for them, I don't just make the appliance, but I will typically give them some type of a sedative to help them sleep better for the next 2 or 3 days. And we adjust the appliance so that it deprograms their muscles so that when they close their teeth, they're closing in a relaxed way. There are 2 ways that people close their mouth together, bring their teeth together. One we call centric relation of like rest, and vertical dimension of occlusion. We have vertical dimension of rest, vertical dimension of occlusion. The occlusion one is where the teeth come together the best. And so if I just ask anyone to close their mouth, all their teeth will touch at the same time. But if I have you tip your head back, open your mouth very wide, and slowly close, keeping your head back and doing it slowly, you're going to find there's one spot that touches first. So go ahead, do that. Go ahead and try it. Tip your head back, open very wide, and slowly, slowly close. There's going to be one spot, where is it, either on the right or left, that hits first. Then, after that hits, if you go ahead and squeeze, the teeth will come together. So that's what we call a hit and slide. Okay? So if you are clenching, if you are grinding, what we need to do is get your jaws to close in the restful position where the jaws are better suited or seated into the condyle into the fossa, rather than where your teeth all come together there best. Okay? And then an appliance will do that. So it's a very useful appliance. It sounds like a lot of money, but it's really not. I've heard of offices that charge thousands of dollars for these things, and we've always tried to keep it in the hundreds so that we can make it affordable. And it's amazing because it works within a week or 2. I've never had anyone take more than, say, 3 or 4 weeks. I tell everybody that it'll be worked out within 6 weeks. And by the way, this condition that you get from bruxism, this pain in your joint, this TMJ pain, it can be so debilitating that you can't chew, that every time you go to bite into food or chew food that is of any substance, you get a Charlie horse in your jaw and you're forced to open your mouth right up and grab the side of your head. So anyway, this bruxism can lead to that, and you don't want that. And of course, nail biting leads to the bruxism, so you don't want to do that either. And yet we understand it is a very, it's a habit like any other habit, like smoking or eating. It's hard to stop once you get started. So hopefully some of this information that we're bringing you today will maybe be the beginning of you stopping your, bad habit of nail biting. And just remember, the teeth Teeth are designed to certainly cut food and cut things for us, but they're not designed to be biting onto really hard things all of the time. You wouldn't continually bite on a bone or a stone, and it's kind of like that. Okay? It's kind of like that. Okay. So now I also, and by the way, remember, it's in addition to onychophagia, the synonym is onychophagy. Okay, so there are two words there that sound very much alike that describe the same thing. And I think what we're going to do is we're going to go to a break now. It's about that time, maybe a little early, but we'll go to a break. And then when we come back, we're going to talk more about onychophagia, nail biting, and its effects on teeth.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
All right, if you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile. It is episode number 470. I really appreciate you tuning in, listening, and being a regular listener. Like, as it turns out, our caller, our winner of the flowers, Barbara, apparently she's a regular listener, so that's awesome. And Barbara, enjoy those flowers from DeSantis, okay? All right, now there are some related disorders to nail biting. Other body-focused repetitive behaviors include excoriation disorder, which is skin picking, dermatophagia, which is skin biting, trichotillomania, which is the urge to pull out your hair, and all of them tend to coexist with nail biting. As an oral parafunctional activity, it is also associated with bruxism, which we've mentioned, and that has those other habits. Now, in children, nail biting most typically co-occurs with attention deficit hyperactivity disorder, 75% of nail biting cases in a study, and other psychiatric disorders, including oppositional defiant disorder, 36%, and separation anxiety disorder, 21%. It is also more common among children and adolescents with obsessive-compulsive disorder. Nail biting appeared in a study to be more common in men with eating disorders than in those without them. Okay, I want to talk a little bit about, we talked about nail biting, but this skin, biting the skin around your nails is just as bad, and honestly could probably make your fingers bleed even more easily. And there was a time when I used to pick at my toenails. I don't know, we haven't talked, you can't bite those, so that's really not the topic for today, but let's talk about it anyway. Well, I guess some people can get their toe into their mouth, I don't know, if you're young and flexible. But I remember I would pick at my toenails, and what happens when you do that is, of course, they tear, and then you tear them all the way into the corner, and there you go, now it's bleeding, and it takes like weeks or months to grow back over the skin. And as a young person, and I'm saying 13, 14, 15, I did that incessantly, and I don't know why, I just couldn't stop. And I eventually figured out how to make it heal. Of course, I had to not bite it, pick at it, but I would put little tiny pieces of like tissue, Kleenex, or toilet paper, push it in behind what was left of the nail to create little space there so the nail could grow out over the skin. And I did that for so long, and it was so painful, I finally broke myself of it, and it was like, boy, I don't want to pick at this again. So guess what? I discovered this new invention. It's called the nail clippers. I didn't know that anybody had thought of that, and so I got those nail clippers, and I was able to figure out that I could clip my nails, both toes and fingers, and I didn't get in below the skin, and they didn't bleed, and when I was hungry, I just had a meal. So I'm not really making fun because I know several people deal with this, and my interest, of course, is as a dentist, but I'm just telling you, I've been there. I've done it, and it's not fun, and obviously it does not look attractive in public, and in fact, there's a video of, I think it's Britney Spears walking down the road next to a friend, and Britney has her right hand up biting her nails, and the friend is off to her right, who takes her left hand and just grabs her arm and pushes it down by her side. And you can probably look that up too, just to like say, don't do that, it looks bad, you know? So, from a point of being healthy, especially with the notion and the understanding that doing this could give you an infection because you're biting nails that have been all different places, right? Even if you wash your hands, there could be bacteria and is bacteria behind the nails. And so that's something that is, if you're a germaphobe and you hadn't thought of that, now I'm helping you with that. So that might be an impetus for you to stop doing it. The other would be the look. And I know a lot of women, love getting pedicures and manicures. And if you bite your nails, there's nothing to pedicure or manicure. And I don't think they can glue those fake nails over top of the skin. I know that I can't make my bonding agents for teeth attached to gum or cheek, or tongue. So if it's skin, it's not going to attach. You have to at least stop biting long enough to get some the nail bed back, so that there's something to glue to. And so it's just one of those things. So maybe the fact that you now know. In fact, you know what? Teeth are vulnerable because it's not just nail biting, but in the textbooks when I was in dental school, there was a thing called bobby pin notch, and I still see that. And it's if you continually use that same spot of your tooth to split the bobby pin open, then you're going to notch the tooth. You're just going to. There's gonna be a little notch there. And then let's see, I had one woman, she came in the other day and she had a notch on both of her front teeth, and I asked her, well, that looks like two bobby pin notches. Do you use sometimes your right tooth and sometimes your left? She goes, no, I have this big clip that I use, and so when she puts it in her mouth, it touches both front teeth. And so she has a double notch. And I don't think she realized what was causing it. She maybe had some sense, but as soon as I asked her about did she open bobby pins with her mouth, she had that look on her face like, how did I know? And no, it's not bobby pins, but it's something else. So, and with teeth, we all know that we can live a lifetime now with having your own teeth. It used to be our parents, maybe grandparents, grew up knowing that they were going to have to, they thought they were going to lose their teeth when they got older, so it's like, well, why worry about taking care of my teeth because I'm just going to lose them anyway. Well, that's changed. I mean, that's history. I still, in fact, the other day saw an 89-year-old woman with all but a couple teeth. And in fact, when we were doing our morning meeting, I looked at the x-rays and I said, oh, we must have the wrong person because that person has teeth and gums and and bone of a younger person. And then we double checked, and sure enough, it was her. So I thought that was pretty cool. So yeah, we want to take care of our teeth. Nail biting is a nasty habit, and so maybe you can kill two birds with one stone by stopping the nasty habit and protecting your teeth for a lifetime. Okay? So that looks like we're almost out of time. And I want to thank you for listening and tuning in each week. I really appreciate it. It's nice to know that we have followers. Don't forget to follow me on Twitter at Dr. Kvitko and visit my office Facebook page, which is Dr. Kvitko and Associates, and like us. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. And be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-2 614-262-9588. That's 614-262-9588. Or send an email to speaking@thereasonswesmile.com.